Hypertensive crisis, causes and prevention. Hypertension is a medical term for high blood pressure. Hypertensive crisis occurs when a person's blood pressure surges to an unusually high level. This condition can cause damage to blood vessels and major organs. This video looks at some causes and symptoms of hypertensive crisis. It also outlines some lifestyle factors that may help lower a person's blood pressure and reduce their risk of experiencing hypertensive crisis. Background on blood pressure. Healthcare providers assess blood pressure using a blood pressure monitor or sphygmomanometer. This tool produces a reading based on two types of blood pressure, systolic and diastolic. Systolic pressure refers to the pressure inside blood vessels as the heart forces blood out to the rest of the organs. Diastolic pressure refers to the pressure inside blood vessels as the heart rests between beats. Blood pressure is measured in millimeters of mercury. A sphygmomanometer displays the systolic pressure reading above the diastolic pressure reading. If a person has a normal blood pressure, for example, the monitor will display a systolic pressure of less than 120 millimeters of mercury over a diastolic pressure of less than 80 millimeters of mercury. What is hypertension? Hypertension occurs when a person's blood pressure exceeds normal values. There are two stages of hypertension, stage 1 and stage 2. Stage 1 hypertension will produce a reading of 130 to 139 millimeters of mercury over 80 to 89 millimeters of mercury. Stage 2 hypertension, which is a more severe form, will produce a reading of 140 millimeters of mercury or higher over 90 millimeters of mercury or higher. According to the Centers for Disease Control and Prevention, around 45% of adults in the United States have hypertension. They also estimate that only 1 in 4 adults have their hypertension under control. What is hypertensive crisis? Uncontrolled hypertension can lead to a sudden and severe increase in blood pressure. This increase is known as hypertensive crisis. A person who is experiencing hypertensive crisis may have a systolic pressure reading of 180 millimeters of mercury or higher and a diastolic pressure reading of 120 millimeters of mercury or higher. There are two types of hypertensive crisis: hypertensive urgency and hypertensive emergency. Hypertensive urgency occurs when a person has the readings above but no associated symptoms. Hypertensive emergency occurs when a person has the readings above as well as the associated symptoms described below. Around 1 to 2% of adults with hypertension will experience hypertensive crisis. Some people will experience symptoms while others will not. Hypertensive crisis can damage blood vessels and major organs. In 2018 alone, nearly 500,000 deaths in the United States had hypertension as a primary or contributing causes. The American Heart Association note that the following lifestyle and medical factors may increase the likelihood of hypertension: having overweight or obesity, Eating an unhealthful diet that is high in salt, not getting very much physical activity, smoking, having a history of cardiovascular disease, having an underlying health condition such as diabetes or kidney disease. The following factors are commonly associated with hypertensive crisis. Not taking or forgetting to take prescribed blood pressure medications. Taking medications that interact with each other in a way that increases blood pressure. Using illegal drugs such as cocaine or amphetamines. Having a life-threatening cardiovascular condition such as a stroke or heart attack. Experiencing organ failure such as heart or kidney failure. Symptoms. Some people experiencing hypertensive crisis may have symptoms, while others may not have any symptoms at all. People who are able to check their own blood pressure may see a reading of 180 millimeters of mercury by 120 millimeters of mercury or greater. If no other symptoms are present, the American Heart Association recommend waiting 5 minutes and taking another reading. If the reading is still high, the person should contact their healthcare provider for further advice. If their blood pressure is high and the person is also experiencing one or more of the following symptoms, someone should call for emergency medical services. Severe headache or migraine, dizziness, confusion, severe anxiety, nausea or vomiting, chest pain, changes in vision, shortness of breath, nosebleed, fits or seizures. Diagnosis. A healthcare provider will take a number of blood pressure readings and ask the person about their symptoms and medical history. They will also ask about any medications or supplements the person is taking and whether or not they have used any recreational drugs. If the healthcare provider suspects that there is a risk of organ damage due to hypertensive crisis, they will arrange for further tests. This may include blood test, urine test, an eye examination, an echocardiogram of the heart, an ultrasound of the heart, kidneys or both, a chest x-ray of the heart and lungs, a CT or MRI scan of the brain. Prevention. The most important thing that a person with hypertension can do to prevent hypertensive crisis is to take their blood pressure medications exactly as prescribed. A 2015 study found that people who often did not take their blood pressure medications are more likely to be hospitalized for heart problems. Some lifestyle changes that people can make to help lower their blood pressure and reduce the risk of experiencing hypertensive crisis. Eat a healthful diet. A healthful diet is one that is rich in fruits, vegetables and fiber and low in fat and salt. Lowering salt intake can directly lower blood pressure. The National Heart, Lung and Blood Institute devised the Dietary Approaches to Stop Hypertension or DASH eating plan for people looking to lower their blood pressure. This is a calorie-controlled, heart-healthy eating plan that does not require any special foods. Cut down on alcohol. Limiting alcohol intake to the recommended levels will help lower blood pressure and improve overall health. The 2022-2025 dietary guidelines for Americans recommend that adults avoid or limit their intake of alcohol. According to the guidelines, men should consume no more than 2 drinks per day, while women should consume no more than 1 drink per day. Keep physically active. Getting regular exercise helps keeping the heart and circulatory system healthy. It can also help people lose excess weight, which can also help lower high blood pressure. The Centers for Disease Control and Prevention recommend that people aim to do 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity each week. However, these figures may vary from person to person. Avoid smoking. Smoking raises a person's blood pressure and increases the risk of experiencing cardiovascular issues such as heart attack and stroke. People who smoke may wish to talk with their healthcare provider for advice on how to quit. Get enough sleep. Good sleep is important to overall health, but it is especially important for the heart and circulatory system. This is because blood pressure drops during sleep. Adults should aim to get at least 7 hours of sleep each night. The following factors can help improve a person's sleep hygiene. Getting plenty of physical activity during the day. Waking up and going to sleep at the same time each day. Following a consistent bedtime routine. Ensuring that the sleeping environment is cool, dark, comfortable, and free from noise and other distractions.